So welcome to two perspectives on psychedelic-assisted therapy for trauma and depression. And there will be two talks as introduced right now. And the second talk will be presented by my friend and colleague Aneta Herrenschmidt-Moller, and will start in approximately 30 minutes. And my name is Nora Mamblona Fischer, and I will talk about trauma integration with psychedelics. And as you can see, here's a question mark. So is there a potential to integrate trauma with psychedelics? And to give you a little bit of my background, so why am I interested in this topic? I work as a trauma therapist in Germany since 2005 and in private practice. And then psychedelics came into my life in 2012. And I'm not talking, this is for the whole talk, I'm not talking about the recreational use. I'm just talking about ceremonial use and psychotherapeutical use. And I started facilitating ayahuasca in 2013. And in 2018, I went deeper and did a traditional Shipibo ayahuasca plant medicine training in Dieta under Ricardo Amaringo. And it continued with compassionate inquiry training, and we'll talk more about Gabor Mate. And as you can see, very recently, I submitted my master thesis on the safety and efficacy of psilocybin-assisted therapy for childhood trauma. And to give you an overview of the talk, I want to go very briefly into the history of psychedelics, and then define terms like what is trauma integration, what are psychedelics, what is psychedelic-assisted therapy, talk about the therapeutic potential, the safety and efficacy of psychedelic-assisted therapy, and then finish with implications, future directions, and open questions. So, why do I talk about the history of psychedelics? This is really to acknowledge the indigenous and their knowledge, their wisdom, their traditions. For thousands of years, they've used psychedelic substances in a ceremonial, shamanic, and religious ways. And here you can see I put a list of some of the psychedelic substances they used, like, for example, the ayahuasca, and the psychedelic compound is the DMT in the ayahuasca, and where they used it. That's in the Amazon, South America. And here you can see a list of, yes, for example, the psilocybin, the mushrooms, which is used in on all continents, here in Europe. And now I make a huge leap forward to the 50s and 60s. That's when there was some first psychedelic research with LSD. And then in the 60s, also due to the movement of the hippies and maybe a little bit more recreational use of LSD, it got a little bit out of hands and it was prohibited in 1967, the LSD, but a lot of other psychedelic substances too was scheduled as Schedule 1 drugs, so there was no medical use allowed anymore, and it was said that it has a high potential for abuse. But during the 90s, for example, in Switzerland and even in Germany, there was a little of psychedelic research on LSD and psilocybin, and in the 70s and early 80s of MDMA, also called ecstasy in the US. So it was a little bit ongoing, but really the psychedelic renaissance we're talking about, that started since 2006. And that was when the first psychedelic-assisted therapy trials were restarted. And now I move forward to 2017. That was when the Food and Drug Administration in the US granted a breakthrough therapy designation to MDMA-assisted therapy for PTSD, post-traumatic stress disorder, in 2017, and for psilocybin-assisted therapy for treatment-resistant depression and major depressive disorders in 2018 and 2019. So, and if I talk about psychedelic-assisted therapy, I really want to mention the mental health crisis we are in right now, which continues to escalate. Also in the last 2 years with the COVID-19 situation. And we have over 1 billion people worldwide who suffer from mental and addictive disorders, from a mental or addictive disorder. And there's an urgent need for novel treatment options. Why? Because current treatments, current interventions have a number of limitations, like significant adverse effects and that delayed therapeutic onset, and it's just approximately 1/3 are resistant to the interventions. And then one of the core elements is also that the current conventional intervention, they're suppressing symptoms and trauma. So this is really where the psychedelic-assisted therapy comes into play. So, and when I talk about trauma integration, I want to give a definition of what do I understand with trauma? What is trauma? What is trauma integration? And so you see there are multiple definitions of trauma. And one is by the American Psychological Association, and I want to read it out. It's trauma is any disturbing experience that results in significant fear, helplessness, dissociation, confusion, or other disruptive feelings, intense enough to have a long-lasting negative effect. And traumatic events can be caused by human behavior or nature, and often challenge an individual's view of the world as a just, safe, and predictable place. And I come back to just, safe, and a predictable place when I talk about psychedelic-assisted therapies, so please keep it in mind. And here's another definition of trauma by the World Health Organization. And I also want to give you one by Dr. Gabor Mate, and I will talk about him in the next slide. So according to him, the essence of trauma is a disconnect from the self. And in some of his talks, he said, it's not the event, for example, the rape. It's not the experience which is traumatic per se, but it is if there's no one you can talk to about your experience, if there's no one listening, that's according to him, his definition of trauma. And I'll also come back to that again when we talk about psychedelic-assisted therapies. And he continues, therefore, the essence of feeling, or you could say the essence of integration, is not just uncovering one's past, but it's reconnecting with oneself in the present. So, and I do recommend watching his documentary, which has been recently released. It's called The Wisdom of Trauma. And he's known for his work on addiction and trauma and his compassionate perspective on trauma and addiction. And also here I want to recommend, if you're interested in the ceremonial use of ayahuasca and Shipibo plant medicine dietas. This is a great introduction. It's called The Fellowship of the River by Dr. Joe Tafur. But now to continue with psychedelics, here you see a picture of psilocybin containing psychedelics. Psilocybin, that's the psychedelic compound of these mushrooms. And you can divide them into classic psychedelics and non-classic psychedelics. Classic psychedelics are serotonin 2R receptor agonists, and non-classic psychedelics are not. And examples of classic psychedelics are LSD, mescaline, DMT, or psilocybin. And here you see like ketamine, ibogaine, and MDMA as examples for non-classic psychedelics. But please stay tuned for the second talk by Aneta, who will go deeper into the neuroscience of psychedelics. and also on the talk on the topic of depression and neuroplasticity. Let's continue with introducing psychedelic-assisted therapy. So why, could I ask, what is psychedelic-assisted therapy, and why combining psychedelics with psychotherapy? And there's psychotherapy has a potential to enhance safety and effectiveness of psychedelics, whereas psychedelics, a so-called non-specific amplifier, can facilitate psychotherapy. So this gives a kind of synergetic effect. Psychedelic-assisted therapy usually consists of screening, preparation, psychedelic, and integration sessions. And preparation, there's in preparation sessions, as the name says, the participant is prepared for the psychedelic session. Normally, there's space to answer some questions and to explain how the psychedelic session will be, and also to talk about what to do, and in case the participant could feel some fear or anxiety, or even have some re-traumatization during a psychedelic session. So that will be talked about by the therapists who will also be present during the psychedelic session. And then, of course, it's also important, and I come back to that here when explaining set and setting, that the participant starts gets to know the therapist who will be there during the psychedelic session, to start a relationship, and and sometimes also it's good to talk beforehand about therapeutic touch. So would it be okay during a psychedelic session for the participant, if the therapist touch the participant, which can be very helpful if someone, for example, has some emotions of fear. And then there's a psychedelic session. Normally it's one or more sessions, and I'm really in favor of more sessions, because if that's your first psychedelic experience ever, it's good to start with a low dosage and to really get used to it, and to learn how to open up, how to let go of control, how to surrender to that experience. And then there's integration, which is essential. And integration, usually there's an integration session the day after a psychedelic session. And here, remember the definition I gave by Dr. Gabor Mate about trauma. This is a place where the participant can talk about his experience during the psychedelic session. He's listened to, and hopefully in a compassionate way. And also he can hear the other participants sharing about their experience, about their what they felt and how they feel, which is also very valuable. And integration is not just about the integration sessions, but this is really ongoing. This can take weeks, months, and even years to integrate a psychedelic session. And very important for psychedelic, for integration, is a good self-care practice. And if you're probably you've heard about set and setting, which is a term often used in psychedelic-assisted therapy. It's a term which already was talked about in the 50s and 60s with the first psychedelic research. And set, that means the participant's psychological state prior to the psychedelic experience, his mindset and intention. And this is one where I will come back to later, hopefully, when talking about there's the psychedelic renaissance, and has brought high expectations. So this can be challenging for a participant if he has high expectations for the psychedelic-assisted therapy. So that comes into role here, that plays a role here. And then there's also the term setting. Under setting, you understand physical, cultural, social context and environment of a psychedelic experience. And the core element of is the relationship with the therapist. So do you feel safe with the therapist? Do you trust the therapist? Do you feel safe in the environment where the psychedelic session is? And the set and setting, here you can see the safety. That's where the psychotherapy comes also into play, and which is a huge difference to recreational use, where you often don't have the preparation, you have no integration at all, but there's also not a therapist present who can give you a safe space and his compassion and his presence. So, and then also I've written down here the term mystical experience. And a mystical experience, that's sometimes defined as one of the among the top 5 most spiritual significant experiences one has in lifetime. And it's a definition isn't easy because it's so beyond what we normally experience, but there's often an immensely meaningful or profound experience that shatters some of the preconceptions of our preconceptions and which can be life-changing. So why a mystical experience? Why have I put it here? It's in 2008, a researcher called Johnson at Johns Hopkins in the US. He did a trial with psilocybin-assisted therapy for end-of-life illnesses, and he showed that there's evidence on a link between having the occurrence of a mystical experience during, in this case, the psilocybin-assisted therapy, and the effectiveness of the effectivity of psychedelic-assisted therapy. And I come back to this also. And for me, the mystical experience, this is also really exciting, because here we are bridging science, psychology, psychotherapy, psychedelics, with spirituality, and in a way also shamanism. So now, and I'm jumping to psychotherapeutical modalities, psychedelic-assisted therapy. There are different psychotherapeutical modalities used in past trials and recent trials. One is cognitive behavioral therapy, CBT, developed originally by Beck. Then there's acceptance and commitment therapy, also called ACT, developed by Hayes. It's a so-called third wave therapy modality. And there are also some very recently developed psychotherapeutical modalities, such as the ACE model, the Accept, Connect, and Embody model, developed by Watts. And this one is based on the psychological flexibility model of acceptance and commitment therapy. They're specifically developed for psychedelic-assisted therapy, this one for psilocybin-assisted therapy for depression trials at Imperial College London. And if you're interested, Dr. Rosalind Watts, she's launching the next level of the ACE model called the ACER Integration, Accept, Connect, Embody, Restore in London on May 6th, in case you want to attend. So now about the therapeutic potential of psychedelic-assisted therapy. Here you see on the left, I've listed the psychedelic compounds like psilocybin, MDMA, LSD, DMT, and ketamine, and then the interventions. Some of the interventions trials have been have been done with. And for example, for the psilocybin with depression and anxiety, especially for the MDMA with PTSD, the LSD, the DMT, and I also want to name ketamine. Why? Because ketamine is legally available for prescription in over 60 countries. And if we talk about the therapeutic potential, you will hear the names, you will see the terms safety and efficacy. What do you understand by safety? Safety means how safe is the psychedelic-assisted therapy? How safe is the psychedelic compound? How well tolerated? And this is talking about treatment emergent adverse events, so-called side effects, treatment emergent severe adverse events. There could be suicidality, could be a topic, and the addictive potential. And in terms of efficacy, this, depending on the mental health condition, you could talk about reduction of depressive symptoms or of anxiety, functional impairment, global distress, PTSD symptoms, depending on what you're looking at. So now I want you to show you a slide, a graphic of recent results of the first phase 3 trial for MDMA-assisted therapy for PTSD by MAPS in the US. And you can see here, maybe I should explain, here are the CAPS-5, that's here you measure the PTSD symptoms in a way, and you can see that if you compare placebo with the MDMA-assisted therapy, the difference, and that there has been a rapid onset of treatment efficacy, even in those with severe PTSD. And compared with current first-line biological and behavioral therapies, MDMA-assisted therapy potential to transform treatment for PTSD. So that are very promising results. And also the recent results of the phase 2 trials for psilocybin-assisted therapy for depression also showed some promising results. So to finish my talk on, is there a potential for the integration of trauma with psychedelics, with psychedelic-assisted therapy? Well, there is a potential. There are therapeutical benefits. There's an increasing evidence of safety and efficacy of psychedelic-assisted therapy, also for trauma-related disorders. And it is a promising novel treatment for a range of mental health conditions. However, there are challenges. One of the challenges is there's preliminary evidence. This is very new. It's restarted since 2006. And really, most trials have been done in the last 10, 15 years. So there's still very small sample size, limited generalizability. But I have to say, preliminary evidence, if you talk about psychedelic research, if you talk about the wisdom and the knowledge of the indigenous, that they have thousands of years of experience with soul retrieval, with shamanism. Now, another challenge are the very high expectations, especially the results of the MDMA-assisted therapy for PTSD led to very high expectations. And that can play a role, as I said before, as I mentioned before, for the participant. High expectations can lead to disappointments. And then, of course, the topic of legalization, which is still in process in most countries. Now, I want to highlight the following sentence. Imagine a medicine that could help people process disturbing memories, sparking behavioral changes, rather than merely burying and suppressing symptoms and trauma. So this rounds up the potential of psychedelic-assisted therapy, also for the integration of trauma. And there's still a lot to do, also in terms of future research directions, like mentioning, for example, MDMA-assisted therapy for depression, or how safe qualitative studies in terms of how safe did the participant feel with the therapist, or what needs does the participant have, and also a comparison on psychotherapeutical modalities and effectivity. So thank you for listening to my talk. I want to give you open up the room for a few questions, and I will also answer questions in the chat. And then please stay tuned for the talk by my friend and colleague, Aneta Herrenschmidt-Moller.
Thank you, Nora, for introducing me. I'm Aneta Herrenschmidt-Moller. Thank you for coming and joining us today. So 2 words about me. I recently finished my master in psychology and neuroscience of mental health with King's College. And I'm myself very much interested in psychedelic research, especially how the psychedelics work in the brain. So I have spent last few months reading through the existing research and like to share some of the findings with you. And I would relate that to depression, how the effects or neurobiological effects of psychedelics can bring about the antidepressant effects that we have been observing in the trials. So is there a potential for psychedelics to treat depression? I try to answer that. I try to talk about how much we know, as much as we know about how classic psychedelics work in the brain, and how they potentially cause the antidepressant effects. And one of the hypotheses, which is currently investigated by researchers, is that neuroplasticity is the mediator of antidepressant effects of psychedelics, because in laboratory we see that once we introduce the psychedelic molecules to the tissues with neurons, or in animal studies, the neurons very rapidly will change their structure. So that's basically. So Nora have touched upon. I don't know what. Yes. So Nora was talking about the clinical trials and the very exciting results that we are receiving and we're hearing about. So you all probably here know about the potential that psychedelics show in the clinical human trials. Especially the psychedelic-assisted therapy has been successful in treating depression, anxiety, obsessive-compulsive disorder, end-of-life distress, and anxiety. We have a pretty solid base to talk about rapid efficacy of these molecules in patients. Of course, as Nora was pointing and stressing, and I totally support that, we must not forget that these molecules are being taken in a specific setting, and we don't know how much of importance that setting itself plays in a beneficial results of the therapy. So though we're trying here to discuss the neurobiology as a separate from the therapy, I would incline to also to the view that they are inseparable, and the therapy is very much a part of the healing process as the molecule. As Nora said, it's necessary to follow a protocol and therapies and healing that comes not just within one session of taking the molecule, but possibly everything which comes after is as important as the neurobiological effects. So why are we investigating psychedelics and why are we so excited about the news? Well, we all know that there is an urgent need for novel treatments, as Nora again beautifully explained to us. The trauma is one of the problem that current treatments cannot address very well. It cannot help the people who suffer from traumatic experiences. And depression is another very big problem in a current world. We don't have current antidepressant treatments are of limited efficacy, and talking therapies or pharmacological SSRIs do not necessarily help people. So we are left with a large amount of population suffering without help. That's why, again, I also think it's very exciting that we are opening ourselves as a researchers, therapists, or even a public to the possibility that psychedelics may be used in the treatment of these disorders. And again, clinical trials suggest that there is something effective in treating depression and other mental disorders with psychedelics. On top, you can see on the side of my slides, contrary to what we were led to believe for many years, the psychedelics are not your typical drug or narcotics. In fact, they have nothing at all in common, I would dare to say. They have very low toxicity. That means they do not damage our organs. And they have very good safety profile, meaning there is low potential for abuse. Of course, I must state that this is a substance which can cause potentially disturbance to a person taking it and to the environment. There are some, I don't like to call it side effects, but there are some warnings that are coming attached. And if we look at the history of these molecules and the way that they were utilized by societies for many thousand years as it comes, they are always taken in a safe settings with someone looking after the people who taking them. And they have specific healing and ritual religious role in a society. So I hope they do not become freely available as alcohol, and definitely not taken as a recreational add-on to our boring lives, something like that. Sorry, but I just like to say that. So this is, we're talking here about therapy, and we need to be careful because they are still classified as illegal substances, and we have to be very careful as a community of researchers and therapists to promote safe use and healing use as a treatment. So there we go. I'm so sorry. And as I believe we all know, let's talk about the depression, because it's something that we all either hear about it or deal with it in our professional or personal settings, and we know how huge the negative impact of depression is on individuals or societies and communities now. It's a very distressingly common disease. It affects between 15 and 22% of population in the West. We don't have a very good statistics from the rest of the world. At one point or another in our lives, we are all prone to experience depression or another mental disorders. So it's on top very persistent and very pervasive disease. It can devastate people for months and years of life. People who suffer sometimes cannot go on, and 50% of people touched by depression will attempt suicide, which is a devastating statistic, heartbreaking statistic. Additionally, depression is not only present as a diagnosis of major depression disorder, it's also very much highly comorbid with other mental or physical illness. For example, 1 in 4 cancer patients will suffer from depression, and about 50% of the trauma survivors, so people with PTSD, will also go through depression. So we know how devastating and how large this disorder, this disease can penetrate our lives and our society. So I think it's really exciting and really important that we research psychedelics and try this treatment for those who don't have any other options and may greatly benefit. Contribute factors that cause depression. We probably also heard about those. There are multiple factors: genetic predisposition, immune system dysfunction, any physical illness which comes, inflammation and others, and cancer, alternation of brain chemistry and circuitry, and elevated. Most of this will be exaggerated or called upon during chronic stress. So we all have kind of predisposition to be stressed, but if we keep living our lives on elevated stress and being taken by chronic stress, that means quickly we may experience depression, which can devastate our lives, basically. So, for example, one form of the chronic and elevated stress are these adverse childhood experiences or traumatic events at any stage of our lives, which cause this regulation of stress and pushes us into that black hole of major depression disorder, which lasts forever. So it's very important that we don't know how to cure depression because we don't really know about the etiology of it and don't really know the progress of depression or pathology is very individual as well. So that's a very big problem in developing new treatments. However, there is one currently available theory about depression, and it states that because stress causes impact on neuroplasticity, disturbances in neuroplasticity in the brain, therefore, to cure depression, we need an agent or therapy that will reestablish our neuroplasticity to the desired level, to the level that was there before stress came and disturbed it. We have some post-mortem studies and we have some neuroimaging studies of the patients which show with chronic depression, the white matter changes in the brain, and also we observe a great reduction in gray matter in prefrontal cortex and in hippocampus. And this happens because we lose synapses in the neurons and we lose dendritic spines. So it's kind of shrinkage. We don't know how many neurons are lost as well, though there is some hypothesis that the cell bodies of neurons also shrink. But in general, we lose connections, we lose the arborization of neurons, which causes functional problems. And you may see during with depressed patients. So we know that prefrontal cortex and hippocampus are brain areas involved in what makes us human. So it involves in thinking and impulse management, learning, memory, and the directed behavior. So we definitely don't want to lose neurons there. And when we do, it's got a devastating effect on our behavior. Additionally, what happens during stress and during trauma, chronic or strong stress, is in amygdala, the process is the opposite. The amygdala neuron grow, the connection becoming stronger. Therefore, amygdala is too active, as you may simplistically put it on. It's become enlarged and more active, and overtaking some maybe processes and causing additional cortical stress and corticosteroid release into the body. So this regulation also between amygdala and prefrontal cortex causes all terrible symptoms after exposure to stress. So what we would like ideally that have an agent or therapy that will reestablish the balance, that will kind of push the neurons to grow better connection and better dendrites in our prefrontal cortex, in our hypothalamus, hippocampus, and we would like to decrease the dendritic arborization in amygdala. We don't want it. And in laboratories, in preclinical studies, researchers took psychedelic compounds and they have exposed neurons in dishes to reactions with it. And surprisingly, they observed neuroplastic changes on the level of single neurons, single cells. So just to quickly remind you, what do researchers mean in laboratory when they talk about neuroplasticity? They concentrate on measuring changes in all levels of the brain, but especially at the level of neuron, in this case, with psychedelic research. So you could see neurogenesis, you can see dendritic remodeling, you can see new dendritic spines, new synapses forming, or some dendritic spines and branches could be pruned. And would we believe that these changes on the molecular and cellular level will cause the whole network of the brain function differently? So we don't know exactly how the changes on the molecular level translate. It's very complicated and nearly impossible for the moment to measure it, especially in humans. And animal research will not give us the right answers, obviously. So we have to think carefully and be more creative, and hopefully new research will answer some questions. But for now, it's very tentative. So we could presume that if you change the structure, the function will also change somehow. But again, I want to stress that we don't know exactly. So it's not like so simple that I take a substance, my neurons grow, I go out, I'm a better person. We don't know that. However, we could think that levels of plasticity start with molecular changes, then some signaling pathways will be changed, new genes transcription will cause new protein synthesis, cell will have enough material to grow and to alter itself and change, new connections will be made, new circuits, then we get to perceive word differently, and maybe then think about the word differently, and finally, when you have all this renewed mechanism of functioning in the brain and looking at outside our brain, we may find a new behavior much more easier, or implementing new behavior easier. That's one way of looking at the plasticity. So Nora have explained that quite well. What are the psychedelics? They are substances that they can alter our minds. They affect our nervous system, and that causes our mood, cognition, perception of the world, sometimes behavior, and the whole consciousness to change. So sometimes this will also include hallucinogenic effects, but not always, and it's not necessary. But we will see the world differently than we usually see it in our habitual way. Classic psychedelics, Nora mentioned, it's LSD, DMT, which you can find in ayahuasca brew, psilocybin, and those are the one mostly used in research. So mostly when the research, today research talks about psychedelics, they will talk about classic psychedelics, and those are the four main ones. As we heard. So what's so special about the psychedelics on a neurological level? Why do they have an effect on us? Mostly because all of them, all in the class of classic psychedelics, have that structure you can see, which here is serotonin, and all of the psychedelics have the same part in their chemical structure. So they basically mimic our own neurotransmitter in the brain. They will, what happens when we take substance, the substance, when it's possible for it to cross the brain barrier, it will go into brain and will start interact with our neurons, with our receptors on the neurons specifically. So once the psychedelic is in the brain, it will find the receptor of serotonin available, and if it's available, it will attach itself and it will produce the same result as serotonin for us does. However, serotonin is a very complicated molecule itself, and we have about 15 different receptors in the brain, and that's still ongoing research, probably more. And we don't know much about it. So the problem is that we don't know about the receptors enough to be able to say what the psychedelic exactly does when it attaches to that receptor, if you know what I mean. However, we know that the psychedelic effects, the alternation of perception changes because of a strong reaction of psychedelic molecule with receptor, which is called 5-HT2A. And how we know that? Because if we use ketanserin, which is a drug, it blocks that receptor, and then we have no effect of psychedelics. So you will have no hallucinations, but also this blocks effects on the cell survival, on neurogenesis or changes. So there is a drug which can actually be taken before and there will be no effect. There are probably other substances, most probably, that will react with psychedelics as well. There are very different profiles of each substance, how it reacts with what kind of receptors, how much stickiness there is between them, because that's also important, how long the receptors can stay attached to the psychedelics, how long. So, and because of that, you will have this psychedelics like psilocybin, which will have between, let's say, 2 and 4 hours of effect, but then you will have LSD, which will go much longer. And so on. You know, it's very complicated. That's why the whole research and the clinical research is very complicated to conduct because of the biological and chemical structure of the molecules, and then individual and so on and so forth. So, yes, the one another quite known interaction receptor that LSD, LSD interacts also with dopamine quite highly, and that is something that you might hear often mentioned. We don't know exactly what kind of effect that has, but the researchers know that LSD also sticks to dopamine. Okay, I don't know how much time I have. Do I have still time? Go on.
You've got 5 minutes. And
Great. Yeah, so quickly, I won't bother you with the actual research, with every experiment. You have to trust me today, and then I send you a bunch of reference you can read and see how actually researchers saw the action of psychedelics in the laboratory and the action of changes in the neurons and all this. A few interesting papers on this. So you can see here on the pictures when neuron was treated with LSD, it suddenly became much more interesting, if I might say. Got much more, the branches grow, it elongates itself, and that potentially leads to new connections, synapses, and new neuronal networks. Could that be a key to treating the disease of depression or anything else? Because we know also in alcoholism and in other mental disorder, there are some losses of the gray matter. And it's difficult to say because apart from this limited studies done in laboratory with animals and animal tissue, the studies done on we don't have enough information, and it's obviously done in very much isolation, and we have to see much more research done to bring things together for us. So I have more slides about the research and the laboratory. You may hear also about studies that's saying that psychedelics cause gene expressions and epigenetics. But this is the secondary effect, I think, because to produce effect of any changes in neurons which are lasting, you do need to have a new proteins, new genes expressed or expressed differently. So the two types of studies, one will investigate genes, and they say, okay, genes related to neuroplasticity are expressed under the influence of psychedelics. So therefore, we may think that neuroplasticity takes place. Or they will measure the changes in the neuronal structures, in neurons and dendrites, and they say, okay, we measure them. We presume there is some gene expression as well, and then there are some therapeutic advantages of that process. So any more studies you like? There are some interesting studies done with human, which try to measure neuroplasticity, if you like, but it's very complicated because we obviously do not have an access to neurons, especially functioning neurons in a human brain. Therefore, researchers went on to measure the level of BDNF. It's a brain-derived neurotropic factor, which is related to the neuroplasticity. But we need to be careful. Some studies show that yes, under the psychedelics, we have experienced elevated BDNF, but how BDNF plays exactly what kind of role and how it interacts with our brain and neuroplasticity, we're not quite sure yet. So just urge you a caution when you read and when you see the news, when you see this kind of studies, that it's just the first of this type of research, and it's good that we're doing it, but it's not very accurate yet. So here you've got more. I can send the slides. You will have all the studies summarized, what each of the psychedelics does and what happened. Right, so just to summarize, according to the evidence we have for today, psychedelics do include neuroplasticity. They include the induced neuroplasticity. It's rapid and it's lasting, and it's just after one single dose, which is really something new. And we don't have many agents or pharmacological agents or treatments that can cause this kind of changes in our brains so fast. We have exercises, we have antidepressants and magnetic treatment that are used to help with neuroplasticity, you may like, or you may use yourself to encourage neuroplasticity in your brain. However, it takes time. It works differently for different people, while psychedelics in the laboratory really consequently each time show that neurons exposed to the molecule will show alternations. And then, as I said, we can presume that changes in neuronal activity and neuronal structure will cause changes in our behavior. But it's just a presumption again. And lastly, I like to urge you a big caution, because though it's super exciting, the topic of psychedelics, we need to remember it's just the beginning. It's a very complex topic, and we need massive tons of new research, and we need legalization of the substance to enable this research, because that's what's exactly stopping now. We have no funds for research because it's illegal. So only private bodies and private sponsors helping to push forward the research. The governments are still holding their hands, and they do not engage in sponsoring, I might say, or giving grants to this type of research, which is very sad. So hopefully all these people, I'm very grateful that there are so many brave people and researchers who do go on and dedicate their careers and time to bring it on, and I hope it will become as normal as any topic to research psychedelics in every laboratory. So remember, there are plenty of gaps, and we need more research, to advance our knowledge and to bring the psychedelics from a laboratory or from illegal substances even to the clinics. Thank you very much. Hope I have put some lights on something that you may like to know. Ask me a question, send me a question, and thank you so much for listening to me.